Hi, I'm Betsy Abramson. I'm an attorney and I'm the Deputy Director of the Wisconsin Institute for Healthy Aging. I'm wondering if you're the kind of person like I am who's ever watched the news and cringed when you see someone lying in a hospital bed, unable to speak for themselves, and heard on camera the parents or the children or doctors and strangers all talking about what this person should have or shouldn't have and what kind of healthcare treatment they should have, all saying, well, they didn't know what he or she wanted. And you've thought to yourself, man, I hope I never end up in that situation. Well, if you are that kind of person, I invite you to think about two questions. One, whom would you want to make decisions for you if you were ever unable to make decisions, either temporarily or permanently, about your health care? And second, what would those decisions be? Why is it important to think about these things ahead of time? Because if you don't make those decisions of whom you want and what those decisions are, and then you do end up temporarily or permanently incapacitated, you'll end up in the middle of a court situation where the court will have to appoint a guardian for you. So it's important to think ahead about both of those issues. Whom would you want, and what would those decisions be? When you're thinking about whom you want, usually people think first about family and close friends, and they should think about somebody who would honor my choices and my preferences. They don't have to necessarily pick the same decisions for themselves as they would for you, but they have to honor what you told them is what you would want in that kind of situation. You want somebody who's assertive, who won't just say yes to whatever a doctor or other healthcare provider puts out there, but will ask hard questions. If you have the opportunity, pick someone who's geographically close or whom you're willing to have yourself move to. You want that person, called your healthcare agent, to come and regularly visit you, meet with the healthcare providers, and make sure that they're around to advocate for your good quality of care as well. You then want to think about what those decisions are. Would you at end of life want ventilators, respirators, feeding tubes? Does it depend on what the quality of life would be? So you want to think about where your funds would be spent, in what kinds of care and what kinds of services, and make sure that agent knows it. After you've picked out the individual and thought about and had a good discussion with that agent about what your preferences are, then it's time to put pen to paper and to fill out the document that's appropriate in your state, and then make sure you give copies to your agent, to your alternate agent, to family members who would be involved and wondering what the decision was about the individual or the kind of care you want. You might also make a commitment to yourself to take a look at that document every year or so to make sure that your preferences are still exactly what you had wanted. Then sit back, relax, and have the peace of mind of knowing that you've made the decisions and you've taken care of this important piece of business in the event that you would ever become unable to make decisions for yourself.
Support for Next Avenue Moments is provided by the Helen Daniels Bader Fund, a Bader philanthropy.